Hello everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Now we will be studying about the recurrent Aphthous stomatitis or ulcer. Okay, let's study what it is. So it is a common disorder which is characterized by recurring ulcers which are confined to the oral mucosa with no other signs of systemic disease. So this kind of ulcers are mainly restricted to your oral mucosa only. Okay, they don't have any other systemic signs and symptoms. This you need to keep in mind. Talking about the etiology, so it can be bacterial, it can be immunological due to the vitamins or due to trauma or due to the endocrine conditions. In the bacterial infections, you have mainly due to the streptococci. It is mainly due to the streptococci. Then you have the immunological abnormalities, then due to iron, vitamin B12 and folic acid deficiency. Due to the trauma, it is due to self-inflicted bites or the oral surgery procedure. If the person has undergone any kind of oral surgeries, then he or she is very prone to developing this kind of ulcers. If I talk about the clinical features, then the clinical features, you have females are more affected than the males, and there is a higher prevalence found in the higher socio-economic people. Now see, people who are having higher socio-economic status, they are more prone to developing such kind of diseases, right? Why? The reason is due to because if you go higher now, you will become a lot stress. There will be a lot of stress in your life. Like one day you all will become a very successful doctor. Along with that, you will be having tremendous amount of stress in your life. Okay, so be ready for that. Next, what I want to tell you is about the classification. So in the classification, first thing that you have is the simple Aphthous ulcer and the complex Aphthous ulcer. Okay, the simple and the complex Aphthous ulcer. Let me just write it down for you very clearly. It is simple Aphthous ulcer. And you have the complex Aphthous ulcer. Now what happens in simple? Simple is described when there is ulcer recurrence after few weeks. Okay, then it is not associated with any of the systemic factors and occurs only 2 to 4 times each year. If I talk about the complex one, then it develops recurrent oral and genital Aphthous ulcer when the ulcers are associated with your systemic disease. Now, the simple one are not associated with your systemic disease, but the complex one are associated with the systemic disease. If I talk about the clinical types, you have 3 types. First one is your recurrent Aphthous minor, recurrent Aphthous major, and you have the herpetiform ulceration. Okay. If I talk about the recurrent Aphthous minor, now this mainly affects the age of 10 to 30 years, more common in women as compared to the males, and the site is more common on non-characterized mucosa like your buccal and the labia mucosa. Next thing is recurrent Aphthous minor. So minor is in number, if I talk, it is 1 to 6 in number and the size is 2 to 3 millimeters to 10 millimeters in diameters. Let's talk about the images. So this is the image that you are able to see. A small bump is there on the oral mucosa. That is your recurrent Aphthous minor. If I talk about the major one, then it represents a separate disease. Okay, it is now regarded as a severe expression of Aphthous ulcers. Common sites are your lips, cheek, tongue and soft palate. Number is 1 to 10 in number and takes 4 to 6 weeks to heal. Heals with scarring. There will be scarring will be present. If I talk about the appearance, then it is extended deeper and may present as cater-like ulcers with rolled margins, which are indurated on palpitations because of underlying fibrosis. See this. You are able to see a lot of, not just a lot of, but a big ulcer has been developed. Next, if I talk about the herpetiformic ulcers, then they are they are recurrent due to their tendency. Then they are herpetiformis because they consist of a cluster of herpetic form resemblance, and ulceration is crops of ulcers are present. Incidence, if I talk about, site is any intraoral sites. The size is 1 to 3 millimeters in diameters, and appearance is characterized by small, shallow ulcers that may be joined together and form a large ulcer. This means there can be small ulcers which will be present and they form a group to form a major one. Just like that, you need to understand that even if there is one person, two person, and they come together, form a group against something, that will lead to a more powerful decision, and that may also lead to the change in decision. So that is the effect of majority. So you have to choose it wisely. Next is, if I talk about the syndromes associated with it, so you have the Behçet's ulcer, that is the most common one, and you have a magic syndrome. See, 𝗵𝗵𝗺 ulcer will be asked as a short note, so we are just studying 𝗵𝗵𝗺 ulcer from that perspective only. Then you have the differential diagnosis. The differential diagnoses are recurrent herpes simplex infection. There can be cyclic neutropenia and squamous cell carcinoma. Just remember this three. Coming to the treatment, for the treatment you have to give tetracycline to the patient, and the dosage is 250 milligrams per 5 ml. Next treatment. Next you have to give this tube. It is an anti-inflammatory and anti-allergic, and it's used to treat the recurrent 𝗵𝗵𝗺 ulcer. Then you have another, a corticosteroid, which reduces the swelling and ulcers in the mouth, and it is applied 3 to 4 times a day on that ulcer. You need to give the patient vitamin B12, you need to give the patient folic acid and iron, and all these supplements needs to be given to the patient. Okay, then I think we are done with this topic. This was actually a very small topic. See, you can either get a 2-mark question or a 5-mark question from this topic, but not more than that. So study this topic from that perspective only. Thank you so much. If you have any sort of doubt, don't hesitate. Please feel free to ask me. Please feel free to DM me. Thank you so much.